Today on the show, we speak with leadership powerhouse Dan Jones. He's with us on Red Hot Healthcare. Let's go.
3 alarm at 21 and north. All engines respond.
This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and welcome to the show. I'm your host, Steve Ambrose, and you can subscribe to Red Hot Healthcare on iTunes, Stitcher, and other podcast directories. And we love to hear from you. Just send your comments or questions to steve@redhothealthcare.com or hit me up on my Twitter handle, PolymathSteve. This show is a part of my life, but my full-time career is different. I'm an expert in consumer and population engagement, so if you're a provider, health system, drug company, payer, health tech organization, listen up. I'm Dr. Steve Ambrose. For more than 2 decades, I broke bread and broke down engagement issues with thousands of my own patients. The result then is what's so badly needed today. They valued, paid, stayed, and referred others. Later, when I transitioned into the tech sector, I led a team that grew internal marketing revenue by 440% and built engagement to support and drive additional sales with millions of our customers nationwide. Hey, I know people. I know patients. I know behavior. Portals, data, analytics, and decisioning, it's all needed, but it's got to be balanced with tactics and strategy that recognize individuality and humanity at the end of your healthcare product or service. If you want a bold, fresh approach, reach out to Dr. Steve by emailing steveambroseucla@gmail.com. You may also learn more by visiting About Dr. Steve on redhothealthcare.com. Now you know. And we're back to our show in 3, 2, 1. Today we have hard-charging executive leader Dan Jones. Dan has had an accomplished career bringing 20 years of successful hospital and health system operations and strategy, working with such giants as Ochsner Health System, HCA, and Tenet. Dan, it's a pleasure to have you on Red Hot Healthcare.
Steve, it's a pleasure to be with you this afternoon.
You know, I've done a lot of research on your background, Dan, and you came into the hospital executive ranks at a relatively young age. I believe you won an award. You've won several awards, actually, at young ages for your work in leadership. So if you could, tell our audience a little bit about how that happened for you and perhaps maybe how that happened at such a young age.
Steve, it'd be a pleasure. So I grew up in a small town in Virginia, and my father is actually a hospital pharmacist. And after school, my mom would drop me off at the hospital, and I would spend my evenings doing homework and helping my dad around the pharmacy there in the hospital, and really got to see the behind-the-scenes operations of physicians interacting with pharmacists during my time as a middle schooler. That really got me introduced to this thing called hospital operations. It was quite interesting. I went on to get my bachelor's degree in economics and business. And from an educational perspective, I had the fortune of doing a couple of internships in the business arena. And because of my relationship to the hospital, I chose the opportunity to do some internships in a hospital, and introduced me to a whole new world of careers within the executive ranks of hospitals, and subsequently was accepted and earned my degree, my master's degree in health services administration from the Medical College of Virginia. And I chose MCV and Virginia Commonwealth University because of, one, the reputation of the program, but two, it required a third-year practical residency, at which time I spent 12 months working in a hospital with a CEO preceptor to really get the ins and outs of hospital administration. And I was fortunate enough to do my residency with Tenet Healthcare in their New Orleans market. At that point, really developed a number of special mentors. And that's really how I got my start into healthcare leadership. My first role after my graduate degree was as an assistant administrator in a small hospital in uptown New Orleans.
Would you call that the job you had in New Orleans the big break or the turning point, or was there something else?
Actually, that was really the door opening, if you will. We had a tight-knit group of individuals in the New Orleans market. There were several. We had roughly 6 hospitals across the marketplace. And I had the pleasure of working with and for a number of the executives, including the market president. My big break, so to speak, came when there was a challenge in the marketplace. We had a struggling facility that had some key service lines, and I was challenged with coming up with basically a strategy to either close the hospital or turn the hospital around. And in my initial analysis and working with the other executives in the marketplace and the regional president, came up with a third alternative. We were actually closed the hospital, but we were able to salvage the license and relocate that license and create a regional rehabilitation strategy within the hospitals across the marketplace. So it was a very avant-garde strategy for the time, the early 90s, and ended up being my big break because of the challenge that I was faced with, one, building the community support for a change in healthcare, getting the physicians aligned to support us in that endeavor, and then ultimately carrying out and executing on the actual strategy of relicensing and moving these beds. And the market president watched me from afar and saw how I handled myself with not only the physicians, but the community, and then subsequently able to execute on the strategy. And that was my big break. At that point, he moved me into a very high-profile chief operating officer role at our flagship hospital there in New Orleans. And that was my first big executive role in health services administration.
I read a bit about your leadership style as well. I always like to do background homework on all my guests. One of the things that I kept coming upon over and over in articles and interviews with you was that your leadership style really focuses on, number one, being a servant leader, and number two, really making sure that you get the engagement of the physicians that work under your leadership. And that seems to have been your staple going through your career. Maybe you could speak a little bit about that and maybe how that helps to define you as a leader.
It's really interesting, leadership. You can look up the definitions, you can read the books, and over time, what I've really been fascinated with is how my own approach has evolved, or my thinking around leadership has evolved, and how you really are starts to become more clear. And when it comes down to leadership, one of the things that has made me successful, that I use with all of my teams, and it's really an innate aspect, is authenticity. One of the keys to being successful in any endeavor is authenticity. And our teams want us to be authentic. They want to develop a relationship with us and support people that they know and have a relationship with. So I would say authenticity is absolutely a key success characteristic for leadership. Again, another more intrinsic desire of mine is being visible. I like to be out and about with the team that I'm leading. That transparency, that communication, that visibility helps develop engaged teams and promotes culture within an organization. Being comfortable and transparent and communicating. Our teams don't expect us to have all the answers, but they want us to be open and forthright with them. And that is something that I strive hard, or have striven hard through my career, to promote. And those two really tie into the common core, which I think is a natural, and that's integrity. And this applies to not only the teams that you lead, but your tangential groups, the physicians that you work with, the community that you serve. Having integrity and having people have the confidence to believe in you because you demonstrate that you're going to do what you say you're going to do is absolutely core to success. And particularly with physicians, I learned early on and literally watching my father and his interactions in the pharmacy, both in the hospital and retail, is that physicians don't want to be placated. They like direct to the point answers. They may not like the answer, but they respect that communication and that direct dealing approach. And that's something I learned early in my executive ranks and continue to promote throughout my career. Two other aspects that I'll throw in that are more kind of intrinsic, but they're leadership characteristics. And one is a thirst for learning. I constantly am reading both fiction, nonfiction, articles, not only reading, but watching and observing, learning about other leaders in the organization, watching how they hold themselves and comport themselves in public and in private. And I would wrap all that up in one final word or characteristic, and that is humility. There are others, either directly or indirectly, accountable and responsible for your individual success. Many times in my career, I found out years later there were people behind the scenes that were helping that I had no idea were involved in the process. So humility is how I'd wrap that up.
Yeah, standing on the shoulders of giants, maybe sometimes giants that are in the shadows, but nonetheless giants, right?
Excellent. Great quote. That is exactly right.
I would imagine you have leaders that, like yourself, are progressive and want to be more transparent and want to be certainly more genuine and authentic, and certainly want to have the buy-in and the inclusion of physicians underneath them as part of the engaged teams. You can't flatten out the hierarchy too much and have too many chefs, working on the dinner, so to speak. Otherwise, things do get a bit confusing and maybe a bit disorganized. So maybe you could speak to that a little bit, that balance between engaging your physicians, but making sure that the hierarchy, the operational hierarchy, is not exactly getting too flat.
Leveraging physicians is key. And when you have medical staffs that approach 1,000 or more in total numbers, and many of those with the evolution of healthcare are moved to purely ambulatory practices and have very little dealing with the hospital operations day to day, but yet are an integral part of our healthcare ecosystem, it becomes very difficult. I'm often astounded by how often I hear physicians say, "You're the first CEO that's ever come to my office," or "You're the first CEO to have even asked." It's flattering on one hand, but it's often kind of disconcerting given their role and impact on us, our ability to improve healthcare in the marketplace. I work to establish both formal and informal leadership. Many people don't recognize the importance of the constituted medical staff and its role in helping manage the medical community within a hospital. But I will create kitchen cabinets, if you will, small groups of physicians that will work outside of the medical staff hierarchy, the medical executive committee, for example. While it's responsible for the business of the medical staff and working with the hospital, I create my own kitchen cabinet of informal leaders, both in and outside the hospital, to help us manage those communication issues or opportunities or build stronger relationships with medical staffs. But you're absolutely right. You have to have an infrastructure, and a good leader is a multiplier. There's a wonderful book by Liz Wiseman called Multipliers, and I encourage many people to read it. Good leaders leverage those that they support and help them be more effective.
Something that I've written about before, Dan, that I feel very strongly about, and that is rising pricing in healthcare, and particularly rising prices from the service side. We have a mass unaffordability problem in the United States. There are so many people that not only can't afford coverage for care, but they can't afford their co-payments or the deductibles for care itself. When hospitals and health systems are seeking and will be lowering their costs, will consumers ever see any of that translated into reduced pricing?
It's a very interesting economic model we have in healthcare, but simply put, I believe the answer is yes. And I believe we're on a pathway to achieving that level of direct consumer price reduction. Unfortunately, I'm worried that we're going to see a bifurcation of the marketplace where some actually get to experience that and others fall into more of a government mandate, and they don't feel it, but they don't participate in it as well. And I won't go too far down that path, but to stick to the pricing transparency and the consumerism drive that's going on currently in healthcare, I do believe prices will drop, and you'll see the biggest driver of this in existing insurance structures, which I would classically call out the health savings account. You're seeing higher deductible insurance plans. You're creating larger health savings account capabilities, and that drives consumerism. The consumerism aspect is driving a proliferation, and I would say a good proliferation, of new access points from telemedicine and using FaceTime on your phone, urgent care centers, to new types of therapy access, and the ability for a consumer now to use their smartphone to anticipate and become more informed healthcare purchasers. Healthcare literacy is one of the other channels that I think is really going to drive pricing for the consumer. Enabling patients to become wiser and more informed about what they really need to do so they appropriately utilize the system. Finally, I think you're going to see this, and it really boils down to regulation and the economic marketplace. The economic structure, the revenue cycle for health systems, whether it's a physician's office or a hospital, is so very complex. And we have niche providers out there that are becoming much more transparent with their pricing. They are more your commodity-based service that people are flocking to. They know what their price is going to be. You're seeing physicians and therapists and different types of providers being very clear and upfront with this. And as that transparency becomes more prolific, when people can shop for their annual checkup on their smartphone like they do for everything else, I think you'll see that accelerate greatly. But we're headed down the path, and I have confidence that we will see that translate into more dollars into the patient's savings account.
Consumer free markets have the ability to drive down pricing and increase quality. And so you have companies competing on that basis so that, if you want to go out and buy a cell phone or maybe, a flat screen TV, that you have companies literally that will put different market forces and different strategies together. But eventually you'll see pricing get driven down for the consumer. And you see that in healthcare, but mostly in the respects of care that's not paid for by insurers. So a great example might be LASIK surgery, where 10 years ago, LASIK was 3 times or 4 times as expensive as it is now, and it was less safe than it is now. And we've seen the prices now to get LASIK surgery plummet. But again, this is medical care, medical services that doesn't involve itself with a third-party payer. It's interesting because with regulated pricing in healthcare, it seems that consumers simply don't have the ability to step in and apply free market forces into this system so that they can shop around for an MRI or if they need knee surgery. And I think to your point, which was just well made, that while you can't necessarily take a regulated system and turn it into just a sole two-party system where you cut out the insurers entirely, I think at least transparency sets us off on the right path where you can start looking at what the costs are in different surgical centers for, let's say, a knee surgery and be able to choose where you want to go to, so long as eventually your insurance is going to allow you to choose between different facilities in or out of state.
you struck a point that gave me a thought that I'd like to walk through with you. And it really breaks the health system into two components. And you clearly articulated the discretionary aspect, LASIK, cosmetic surgery, non-emergent, episodic care opportunities. I think that arena, when you look at the ability of a consumer to have the opportunity to shop, you're absolutely going to see the market forces work appropriately. I think that's where you'll see the proliferation of HSAs, allowing more people to use their own money as they see fit for those discretionary healthcare choices. What it generates is a bifurcation in the model of financing. And you're starting to hear this as well. If we create really a two-tiered economic model where you have your health savings account to manage your discretionary choices, but then you have an emergent infrastructure or financing structure that takes care of the catastrophic or the non-discretionary spending, which would be your ER visits or the surgeries that can't wait. But I think you're spot on in your observation there, and you may see that evolve as we move through the next administration.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.